Hi, everyone. My name is Ike Hasley. I'm a sports medicine fellow at Mayo Clinic Square in Minneapolis, Minnesota. Um, I recently finished my physical medicine and rehabilitation residency in Rochester, Minnesota, and I'll be talking about fall prevention. This is part of the Mayo Fellows Association Charterhouse series, and will be displayed on July 11th. I don't have any financial disclosures or conflicts of interest. There is no off-label usage being discussed. And just as a disclaimer, this educational series is not intended to replace patient-specific medical advice. In terms of the learning objectives for today, we're going to be describing the importance of fall prevention. We're going to review common fall prevention strategies. So why is fall prevention important? Falls are the leading cause of injury among older adults in the United States. Your chance of falling will increase with age. The annual incidence of falls in those older than 65 is around 27%, so around 1 in every 4 and close to every 1 in 3. This is higher for those that are living in healthcare facilities. Falls occur in women more commonly than men, and they are noted to be the leading cause of ER visits, hospitalizations, nursing home placements in elderly individuals. They may cause a decline in activities of daily living, which is essentially defined as just things that you do every day: waking up, going to get dressed, going to go to the bathroom, showering and grooming, bathing, toileting. Those are what we describe as activities of daily living. And again, falls can cause a significant decline in those realms. In terms of what we can see from falls, in terms of what specific injuries we can see from falls, 41% of falls, so nearly half of falls, will result in some sort of at least minor injury. 6% of falls can result in a major injury. In terms of minor injuries, these can be soft tissue injuries, such as your skin, tendons, things like that. And these can result in bruises or scrapes that may have to be treated by a physician with sutures or something like that. But in terms of more serious injuries, fractures are very common with falls as well. One thing that we always worry about is a hip fracture, because there is significant morbidity and mortality associated with hip fractures. And 95% of all hip fractures are thought to be caused by falls. Again, more serious injuries that can happen: traumatic brain injuries and spinal cord injuries. So in physical medicine and rehabilitation, which I did my residency, these are specialists that very often deal with things like traumatic brain injuries and spinal cord injuries, especially in those who come into the ER, are in the hospital. Sometimes someone has to have surgery after a fall, and sometimes they need a little bit more help in order to function and do those activities of daily living that we were talking about earlier. And so they may go to somewhere like inpatient rehabilitation, where we spend a lot of time each day with occupational therapists working on hand function and strength, speech therapists working on swallowing safely, communicating, and trying to get communication back to normal, as well as thinking, and also physical therapists, getting up, getting around, going to the bathroom, things like that. So these are just a couple of examples of, on the upper right here is a traumatic brain injury. These are classified in different categories. So if you have something like a mild traumatic brain injury or a concussion, that's going to heal a lot faster than something like this, where we see blood on the right side of the brain here in what's called an epidural hematoma. In terms of spinal cord injuries, this is demonstrating what's called central cord syndrome. This is when someone falls and they don't have time to brace themselves with their hands, and they hit something like their chin and their head goes up and backwards. And this can result in something called central cord syndrome. And what that is it usually affects the C5 and C6 levels. And these levels are very important when we're thinking about using our hands and grasping things and doing fine motor control. And so your hand function can be compromised in a fall such as this. This slide is talking about why falls occur. And so they're often multifactorial, as I have written here. This is from Up to Date. This is kind of like the Google of medicine, where you know, people in healthcare, when we're reading about a certain topic, it provides us a lot of useful information in terms of how to counsel patients. But as a patient, this is also available to you in what's called an information for patients section. So this is available online and Up to Date if you search fall risk or falls in Up to Date. And so this little Venn diagram talks about intrinsic risk factors, extrinsic risk factors, and precipitating causes, which ultimately lead to a fall. So what are some of the intrinsic risk factors? And I've kind of highlighted some of these in my text as well, which is larger on the left here. I know this can be hard to see for some. Gait and balance impairment. If someone has diabetes and they have peripheral neuropathy, they may not have as good a sensation in their hands or feet. If they have inner ear dysfunction, muscle weakness, vision impairment, any sort of comorbidities such as chronic illnesses. Again, as you advance in age, these are more common. If they already have impaired activities of daily living, if they stand up and get lightheaded, dementia, a lot of medications can cause decreased balance, sleepiness. So that's one thing that we'll talk about as well. In terms of extrinsic risk factors, there are environmental hazards, which we'll talk about, footwear, restraints, things like that. So all this can, you know, be going on in the background. And then we have this precipitating cause. There's a trip, a slip. Someone has something called a drop attack. If they get lightheaded, if they get dizzy, if they get acutely ill, such as, you know, a urinary tract infection can make you more confused. These can all lead to something like a fall. And again, this is just some things that I've highlighted here that I thought were important to me, that could be some intrinsic risk factors. Again, why do falls occur? Well, one thing that we know, as we age, our muscle activation and composition changes over the years. Elderly individuals will tend to activate their proximal muscles before their distal muscles, and this can lead to poor stability. So if you're trying to step forward with a foot, you're going to activate these really strong hip muscles and your quadricep muscles in your thigh. And those are going to go just a little bit faster. And that's when you get ahead of yourself, because your ankle muscles just aren't responding quite in time compared to your more proximal muscles up in your hip or thigh. In terms of balance recovery, if someone has a postural disturbance, so if you get jolted slightly, it's been shown that balance recovery, again, slows as we age. After the age of about 30 or 35 or so, everyone experiences what's called sarcopenia. So they have decreased muscle size and cross-sectional area. This can often be replaced by muscle adipose tissue. Again, this is going to happen to pretty much every individual in the world over time. However, we can slow this, and so that's why we're going to talk about physical exercise going forward. They did a study in which they found that increased fatty tissue in muscles were associated with recent hip fractures. And so they think that this is all playing in to falls, hip fractures, and being as physically fit as we can be. Again, this is kind of a repeat of my prior slide of why falls occur. And we're going to address some of this. Visual impairment. If we have prior history of falls, if you get blood pressure changes when you sit to stand, chronic diseases, especially those such as Parkinson's, that leads to postural instability, chronic pain, knee arthritis, diabetes. Again, that can contribute to things like vision impairment, decreased feeling in our feet, as well as cerebrovascular disease. There are various medications that can increase your risk of falling if those make you sleepy or dizzy, things of that nature. Alcohol use certainly disturbs your balance. Poor footwear, as well as environmental factors. If there are uneven surfaces in your home, if there are loose rugs, then those are things that should be addressed. So what can you do to prevent falls? I would say one of the most important things to prevent falls is regular visits with your primary care physician. So if you have a prior fall history, that might clue your physician into looking a little bit closer at your fall risk. We're going to watch a very quick video here. This is what's called a timed up and go test.
The timed up and go, or tug, tests functional mobility. To perform the test, you need a chair and a stopwatch, or a wristwatch with a second hand.
This is something that your physical therapist might do.
Chair, feet flat on the floor, one foot slightly in front of the other, and hands on the armrests of the chair. Put a line on the floor 10 feet or 3 meters away. Ask your patient to stand up from the chair and walk at the normal pace to the line on the floor when you say go. When she reaches the line, she should turn around, walk back to the chair, and sit down.
So essentially, this is just a time test of how quickly you walk, you stand up and walk and come back.
Stop timing at the moment she sits back down in the chair. While she's walking, stand between the chair and the line in case the patient loses her balance and you need to assist. Observe and note the patient's posture, width of the base of support, step height, stride length, arm swing, and path. When the test is complete, record the time. Also record whether the patient used an assistive device, and if so, what type. A community-dwelling older adult who takes more than 12 seconds to complete the tug is at increased risk of falling.
So that was a video from the CDC. And again, that's called a timed up and go, or a tug test. And that's a very common
tests functional lower body strength. To administer this test,
that's a very common test that we use, especially in physical medicine and rehabilitation, in order to assess someone's fall risk. There are many tests like that, and that's just one. And so if your physician determines that you are at an increased risk of a fall, they may refer you to someone like physical therapy to work on things like that in order to identify any weaknesses that we can address and work on. Again, a yearly vision screen is important. And this can be done at your primary care physician office. And if you need to be referred to a specialist, then that's something that they can help you with as well. In terms of what's called a MedRec, or a medication reconciliation, this is when your primary care team or your healthcare team reviews all your medications, identify those that may be those higher risk medications that could cause falls, and try to decrease those or wean off of those. They'll do a very thorough physical examination, and this is where we can come up with something like a personalized fall prevention plan. So what else can we do? One thing that we can do is keep moving, and this is directly from the Mayo Clinic website, which I had a little screenshot of on the prior page. There are various benefits to exercise, with falls being one of them. The American College of Sports Medicine has what's called their FIT recommendations. This example over here, again, I know slightly hard to read. This is for people with hypertension, a very common chronic disease. So the FIT stands for frequency, intensity, time, and type. And so in this example, they talk about aerobic or resistance exercise 2 to 3 times per week. They go through intensity, time, and type. But what I really want to focus on here is, one, the resistance part, We want to keep those muscles strong in our legs, but also the neuromotor part. So this is something like doing functional body weight exercise in order to incorporate some balance into our everyday lives. That's training our brain and training our muscles to work together in order to stay safe. We recommend to focus on, again, on strength and balance. Your physical therapist can certainly help you out with this. And they may recommend things like Tai Chi, Pilates, yoga, things like that this gentleman is enjoying here. What else can we do? Footwear. So again, Mayo Clinic's website has information about this, and the word that they use is sensible, which I think is a great word. Clearly, we're going to get some better proprioception, as in how is your foot telling your brain where it is in space. We're going to get better proprioceptive feedback with this shoe on the left here compared to this one on the right. So be sensible when you're choosing your footwear. You want something that is fit well, provides good support. Again, just to let your brain know where your foot is in space. What else can we do? We can decrease external risks. So proper lighting is very important, especially in high traffic areas. So having something like a light that you can put on your wall and touch when you're going to go to the bathroom at night or something like that can be very useful. We want to remove or secure any loose rugs, floorboards, things like that in the home. We want to clear tripping hazards from our walkways. Common items that we use every day should be within arm's reach, so that we're not constantly reaching up and putting our bodies in compromised positions. Non-slip mats and grab bars in bathrooms can also be very useful. So in this example here, it looks like whoever's home this is may have someone over, like their family and maybe some grandchildren, things like that. Obviously, those coats can get thrown on the floor, especially in this clearly higher traffic area. And so what we've done is installed a little coat rack here so that all the kiddos know to throw those up on the coat rack and keep them out of the way where anyone could trip and fall on them. What else can we do? There's a lot of assistive devices that are available. Some of these are over the counter. Others may be better for a formal evaluation with your physician, whether that's your primary care physician, a PM&R physician, or physical medicine and rehabilitation physician, or a physical therapist. So this gentleman has, a stylish wooden cane here. This is probably a single point cane, whereas something like this is what's called a quad cane, and this provides a wider base of support. And not everyone always likes these, but these can be used kind of as needed. You don't have to use this all the time. It can be used depending on what activity you're doing. So this gentleman here has what's called a front-wheeled walker. There's wheels in the front, and that provides some sliding ability, but there's also a rubber base at the back, and that will prevent it from sliding if he needs. And so he's using this to go on a walk with his dog. What sort of novel approaches are there out there? So again, my field, physical medicine and rehabilitation, we have what's called inpatient rehab at Mayo Clinic. So if anyone does experience a fall and they have to come to the ER, maybe get a surgery or be hospitalized, let's just say they're not quite safe to go home yet. What we will do is we'll take them over to inpatient rehabilitation. For our average length of stay is about 10 days, and they work with therapists such as the ones in this picture quite a lot in order to get back to doing those activities of daily living and going home and not experiencing another fall. So what we're working on is accurate classification of things like traumatic brain injuries and spinal cord injuries. Mayo is a model system for both of these sort of injuries, which means we work with various institutions across the whole country in order to gather a lot of research data and improve our rehabilitation approaches and techniques with these sort of injuries. And so these guys are using some new technology where it looks like this gentleman may have some weakness in his legs, and they're incorporating a virtual reality screen while he's walking. in order to simulate maybe some more difficult environments, and so that he can get used to coping with those in everyday life. So in conclusion, falls are very common and they can have severe complications due to injury. Your fall risk can be decreased by using basic proactive measures, many of which we discussed about here. But again, my ultimate advice is to see your physician regularly for individualized fall risk assessments and preventive strategies. Here are the locations up in Mayo Clinic, and I'm now up here in Minneapolis, Minnesota. And I'd invite you to ask any questions. Here's my email right here, and I'd be happy to help or provide any further information. Thank you.